Hi, everyone. Hello and welcome to the Flint Community Webinar, your community resource every Friday at noon. I am so excited about the group that we have to talk to you today. We're going to go ahead and get right into who we have for you. So first up, we're going to have GHS is going to talk to us a little bit about suicide prevention and talk about some of their intake and outpatient services. We've got Christine Milak from GHS to talk about those services, and wonderful Carrie Chanter here again to talk about some of our suicide prevention resources in the community. And then we'll talk a little bit about all things air. If you look outside, you can see how gloomy and cloudy and smoky the air looks like. And we've really tapped local experts to talk to you about this. So we've got Brad Snyder with the Genesee County Health Department to give us some thoughts from the health department. And we've got our experts, Dr. Wall and Dr. Huang, to talk to us a little bit about how that's affecting people and what people might be experiencing. And we're going to chat a little bit so that we can bring that trusted resource to you. So we're going to get right into it. Thank you so much. All right. I think we are starting with Christine, and I see. Hi,
yes.
Christine.
Hi, good afternoon. I'm actually I do have a few slides here, so I'm going to go ahead and share those.
Fantastic. Go for it.
So thank you for having me here today to talk about, I'm going to talk about our general process for intake so people will know how to get into services. And then I'm also going to talk a little bit about a couple of new services we have for outpatient therapy. So pretty excited to be able to tell people about that. So most of you know, or maybe people don't know, that Genesee Health System has been in the community for many years, for over 50 years. And we used to be known as Genesee County Community Mental Health, but in 2013, we changed our name to Genesee Health System because it encompassed more of our services. We've been adding services over the years. And like I said, I'm here to talk a little bit today about some of the expansion of some of the services. And there are more services than what I'm going to talk about today, but I want to highlight a few things. The first thing that I want to talk about is our entry to care. So for anybody who's seeking services, they or their guardian can just call our main number, which is on the screen there, the 810, I see I have a little typo, sorry, 257-3740. Or the other thing to know is that people can actually just walk in to our building and request services. And I know people don't typically think they can do that for mental health if they're not in crisis, but they can just walk in and request to speak with a care specialist. The care specialist does maybe a 5 to 10 minute triage, either by phone or in person, and finds out. The triage is really just a conversation to find out what kind of things are going on for the person and what kind of services they might be looking at. Sometimes they're looking for resources. So they're just looking for things like shelter, food resources. Sometimes they are looking for mental health services, or they need to find medical care, primary care provider. So our care specialists can really help with a whole array of things. But what they end up doing most of the time is people are coming in looking for mental health or substance abuse services, and they can connect them to the Region 10 Access Center to determine that they're eligible for our specialty services. Or if they're looking for something on the mild to moderate range, like your traditional outpatient therapy, they can connect to those services as well. They do like I said, that brief 5 to 10 minute triage to get people set up with that. So at our intake, it's, as I mentioned, you can now walk in. We're doing same day intakes. So it used to be that if somebody were seeking services, they would call, they would get scheduled for an appointment, and then they would come in on that day of the appointment. And we've changed things a little bit so people are able to come in on the same day that they're seeking services. So, many times it's kind of, even if it's not a crisis situation, people feel like in the moment, this is when I want to get the help. So they are able to just walk into our building and do that. The intake process does take a chunk of time. It takes about 2 hours. So we do ask that people have that time available, but if they don't, we explain that to them and they can opt to just walk in on a different day when they have the time to do it. So they can come in and have their intake for services. And then we get them in for their actual first clinical service. So they have that assessment, and after that, they would have their first clinical service within 2 weeks. So we're all about getting people in as quickly as they can. And these are for our specialty services. So they're the more intensive services like case management or wraparound or such. But the other thing that I wanted to talk about is for people who are not needing that high level of service, but want a counselor to talk to. And this can be for any kind of stressor, can be for depression, anxiety, family problems, just really kind of things that interfere with and impact our lives. And so we are offering evidence-based outpatient therapy now at a new clinic that we opened. It's at 1513 South Center Road in Burton. And you would use the same entry to care process of calling the care specialist. They'll get you set up with an appointment. And the other things that are important to know are that we have, for people who don't have insurance, or for people who are, we would use the term underinsured, but really it means that your insurance might not cover the cost of care. We can provide those services. We have grant funding for that. We have a sliding fee scale. For most people, the cost of service would be either no or low cost. And by underinsured, these are people who perhaps have insurance, but they have a really high deductible. And so it's really like they're paying out of pocket for services until they've met that deductible. So we just really want to get the word out, because this is a pocket of people who don't have, who may not know that there are services available. They sometimes don't reach out because they think the added cost will be an additional stressor. So we want people to know that that's available. And then the other thing that's pretty exciting that we're offering is we have therapy for the people who are deaf or hard of hearing. Our therapist is fluent in American Sign Language. And so, well, it's helpful to have an interpreter, and people who are deaf often use an interpreter, but it's very nice to be able to communicate in your own language with your therapist without having to go through an interpreter service. So we're pretty excited to be able to be offering that service now too. And here's our contact information. I wanted to kind of keep this brief when I saw the other topics we're going to be talking about today, because getting into care is really just a brief moment in time, coming in for that first day and such, and then we take it from there and help you out with all those services. But I know we've got this issue with the air quality going on today, and excited to hear more about that, like what we all should be doing. So.
Oh, I think this is equally important. People need to know how to access the resources in their community. We super appreciate you for all the work you do and all of the resources that you're able to provide. I think it's equally important and really cool that you all provide resources across different disabilities, right? So making sure that you have accessibility for people who need American Sign Language, different languages, different resources, that is really helpful to people who might be needing those services. So thank you so much.
Oh, you're welcome. Yeah, and really can't highlight enough that people should not worry about the cost of services. Just contact us and we'll get you taken care of.
Right. And I see we put Carrie in, who's got some really wonderful resources that she's going to share with us with people who might be needing them. So Carrie, feel free.
Hello, everybody. My name is Carrie Chanter, and I am the Director of Prevention, Health, and Wellness at Genesee Health System. I am going to go ahead and share my screen and give you a quick update on what we're doing for suicide prevention in Genesee County. Okay, there we go. So I did want to let you know that recently Genesee County has basically stood back up a suicide prevention group, a coalition we're calling it. We're really excited because the mental health millage dollars has really kind of allowed us to expand and maybe coordinate or offer to be a backbone to Genesee County suicide prevention efforts. So while it's coming out of GHS, we're kind of parenting it. We really know that it's important at any community coalition to have lots of different valuable stakeholders at the table. So we're still kind of working on that. We're very much in the infancy of that. And right now we do have a really nice group of people that's been meeting. This is going to be our fifth monthly meeting in July. So excited about that. We've gotten a lot of work done. So we're laying the groundwork for some really successful things, really excited about it. So I just want to take you through some of where we're at with that. But also, I would like you to know that you are all welcome to have a seat at the table. We have lots of different important stakeholders that are represented so far. We've got some local university participation. We've got some mental health providers. We've got a couple hospitals, lots of school representation, school social workers, still working on the faith-based community, but we do have a couple leads there, which is exciting. We have a couple survivors of suicide. So we really want a more robust group. So I am welcoming you to attend and see what it's all about. So I'll put my email in the chat so we can hook up and I can make sure you get that meeting invitation information. So far our participation, we are mapping this on a quarterly basis because really we don't want it to just be a Flint coalition. We really want it to be represented from the entire county. And as you can see, there are some, just glancing at this isn't perfect, but there are some spots in Genesee County that we really could use some participation from. Just glancing at it, maybe Montrose, Otisville, Mount Morris Township. We could use somebody from Flint Township, City of Burton, Gaines, Mundy, Fenton Township, Argentine, and so on. So Linden's in there. So that just is gonna, as we progress over time, I'd like to see that map a little bit more filled up so we can say that we're fully representing the entire county. Now, currently, we are meeting in Flint at our new children's building, just to be centrally located right now. But I do see us in the future kind of going out to different trusted areas, like a senior center or a public library or a school in different cities so that we are a little bit more represented. So just as a reminder to those people on this call, many of you probably already know that there are certain risk groups, right? We know that suicide doesn't discriminate. However, we do know that there are certain groups of people that are at higher risk of suicide. And this is just a little bit of a reminder of that. Obviously, our veterans and active military are some of those groups, adults over the age of 45, the LGBTQ plus population, youth, attempt survivors, suicide loss survivors, disaster survivors, the American Indian and Alaskan Native group, those who live in rural areas, we know that's absolutely a risk factor. Workers in certain industries, those that have mental health or substance use disorders. I will say a group that has been historically protected by suicide rates is the African American population. However, there's been a ton of studies out in the last 10 years that really it is going up at a rate that is much faster than any other group. So that is another at-risk group that we are focusing on, as well as the African American population, specifically youth. So one of those things that we do have in place so far, again, we just started meeting in March, is our strategic plan. I will not take you through every single objective. I just circled on the next 4 slides what our 4 goals are, just so that you're kind of aware of what our goals are. We are absolutely focused on training, not only trainers for training for clinicians, but training for everybody. We know that a lot of times people might express thoughts of suicide to a friend at a barbecue, to somebody that they're with, not necessarily a clinician or a parent. We know that there's lots of people that might get hints of suicide, right? So we want everybody to be trained at whatever level is appropriate. So we're really focusing a lot on training. We're also, our goal number 2 is really focused around community awareness of available resources, making sure people are aware of what's already out there. People know about the 988 hotline. People know what to do if there is a suicide attempt in a school or a family, what to do with postvention and things like that. So, because we do have a rich community with lots of resources, but I don't know that always people know where to get it, how to find it, and what's available. So that community awareness is definitely one of our goals. The third goal is to reduce the stigma. Just like mental health and substance use, suicide has a huge stigma surrounding it. And there's lots, we can have a whole nother session on that. There's lots of reasons why that is, but we're going to be working on stigma as certainly a part of it. We're going to try to do 2 events per year that we're going to be sponsoring, which would be May for Mental Health Month and September for Suicide Prevention Month. Those are going to be our 2 goals. We also, in the meantime, want to be very active in lots of different community events. We've got a lot planned this summer. We're still kind of building up our marketing and our brand per se, but we will have some materials at some different events. So excited about that. Our 4th and final goal is to provide support. And we've basically identified 4 groups, although I think that might be changing to 5 groups of at-risk population that we are going to be intensely focusing on. Now, I know they're not all included here, but we know that however we do this year and perhaps next year, we expand a couple more at-risk groups as well. So we are focusing on our Genesee County school districts. Very exciting news coming. We have a lot of school districts that are going to be implementing a peer-to-peer program this year. So excited as a coalition to be able to support that. We also obviously are going to focus on veterans, the LGBTQ population, as well as Michigan males. I do think that African-American youth may be a 4.5 on here. We're still kind of finalizing that. But those are the groups that I think that we're going to be intensely focusing on providing more support to. So that was our strategic plan. Something I want you to know about though right now, and I talked about this before, but it's probably been some time. We have been able to, through grant dollars, purchase a bunch of Living Works START training licenses. So Living Works is a worldwide, actually, they're out of Canada. They're a worldwide training partner for suicide prevention, and they have lots of different products. Most of them happen to be in person. This one is kind of that gatekeeper hour training online self-paced course. It's meant for everybody. It doesn't have to be a clinician at all. But we actually made all of our GHS staff take it. It's generally about a $45 cost. But again, like I said, through grant dollars, we were able to secure hundreds for our county. We've probably trained about 1,000 so far, but I know that we have lots of available licenses left. So I would ask that anybody on this call, this is very low hanging fruit. If you are interested in taking the course, my email is on the slide and I will put it in the chat. I will hook you up with how to do it for free. There's a little process, which is just an email and a click and putting in a code. I will take you through those steps and how to do that. But again, it is an awesome course because sometimes online courses are not awesome, but this is designed so well. And it basically gives very concrete steps on those 4 things in the very middle of the slide. Tune in, asking, stating, and connecting. It's task, TASC. And it takes the user through a very easy way to listen, to ask if they're thinking of suicide, to basically state back, this is what I'm going to do for you, and then connecting the person to the appropriate resources. So by getting more people in our community trained, we're creating a safety net, essentially, right? So that maybe more people will be trained and how to connect people to resources. So if you're interested in that, even if it's a group of 30 staff or whatever, I'm absolutely happy to get that rolling for you. And like I said, we'll have more trainings in the future, but that one's real quick and easy to be able to offer. So another thing I just want to remind everybody, if you weren't aware, we're at least 6 months in now of having the 988 established across the country, actually. So the Suicide Prevention Lifeline has turned to 988, and all the research that I've read so far is that there's a huge increase of calls, which is exactly what we expected. And it's a good thing. So people are utilizing it more. And I will say that the 988 still allows for specialty connections, like for veterans and LGBTQ. So there is options once you call to get connected to a counselor that is specialized in that. I also want to reach out and make sure that you all are aware of the GHS crisis services, our BHUC, the behavioral health urgent care, the numbers on here. We do have 24/7 local texting support as well as virtual support. Pretty soon our behavioral health urgent care should be open 24/7. Right now we have extended hours. It's just not 24/7, but you always can get a hold of somebody virtually and by phone and texting 24/7. So we just want people to know that. As I kind of wrap up here, and this is something I've gone over with our coalition, and we do this at every meeting, and the reason is because we've all been raised in different backgrounds and taught different things, and sometimes there's language that we use that we don't intend to hurt people or promote stigma, but we do try to avoid certain language when we're talking about suicide. And this is just a reminder for those of you, and some of you, this might be the first time you've ever seen this. There are a lot of people, and I continue to hear people say committed suicide, and it's because we were raised that way, right? And that's what you do. So, and like, let me give you an example. So language to avoid, we probably shouldn't be saying committed suicide, because the first thing we think about when somebody says committed is either crimes or a sin. And we really don't want to assign that type of moral anything to suicide. That really is what's promoting the stigma surrounding it. So committed suicide probably is better to say died by suicide. And I catch myself, and this one was like a successful attempt. Success should not even be correlated ever with suicide, right? So it's probably better just to say they killed themselves. If you have to say anything, they killed themselves. And that was hard for me to say that, but honestly, that's a preferred language over some of the other options. Completed suicide, again, completed almost assigns a positive thing to it. So killed themselves is probably a better option. Attempted suicide is, again, that is preferred. Incomplete suicide attempt, again, assigns some sort of like failing because it didn't work. So suicide attempt is probably better. Unsuccessful suicide, it's probably better to say suicide attempt or suicide loss survivor and so on. So there's some language that we really should avoid as we tread this territory. I guess I'd like to just kind of end by saying our next meeting, we tend to meet, I think it's the 4th Thursday of the month. And our next meeting is Thursday, July 27th at our children's building on Saginaw Street, the new one. And it's from 9 to 10:30. There's an option to attend in person as well as virtual, but I do need you to sign up, because if it's virtual, I send you the link and all of that stuff. So, I guess I'll stop sharing and then ask if there's any kind of questions at all. That'd be awesome.
Carrie, you always bring such really important, trusted information. And I always learn something when you're here, right? Like everything you said makes sense about our language, and language matters so much. And I think just the opportunity to learn and be thoughtful about our language as we engage in these conversations is important. And I sort of took a note to myself to think about it even in the office. So in our office, we have a behavioral integrated care model. And so we frequently have behavioral health kind of have some of these conversations, and I took away those points that you made about the preferred language, and I'll make sure to incorporate that in my care. So super thank you to you.
Of course. And I got to tell you, you have to have a little grace with people, right? I'm 45 years old. My mother has said committed suicide her whole life. And has looked at me and said, it's a sin, you're going straight to hell. And part of that is the stigma that we've all kind of raised and been raised with. And so it's sometimes hard to flip the switch a little bit. And I'll tell you what, some of this training that we are hoping to bring does kind of reframe the conversation around suicide a little bit, just to not assign a moral failing to it or blame and all of that stuff. So it's really important as part of the stigma piece. So thank you. That was a nice compliment. And I do give grace to people because, listen, I catch myself sometimes saying, a successful attempt or something like that. And I'm like, I have to stop myself, So, and again, it's a really delicate topic, right? It's really hard to discuss. We know that.
Also, thank you, because it is a difficult topic. And I think it's important to destigmatize and make sure we're having those conversations in public spaces so that people get the information and aren't afraid to ask the questions. So again, thank you so much for being here. Super appreciate your resources.
You know what? Can I actually add one more thing? Because I'm looking at the time like, oh, I got a couple minutes. I wanted to add one more thing. I did not share this. So we're really excited. There's a nationally recognized framework called Zero Suicide, and it's really about health systems. Usually hospitals and big health systems are the ones that implement that kind of thing. So we're really excited at GHS. We are in year 1 of implementing Zero Suicide. And what the short list of what it is it's basically infiltrating every level of your system to catch people who are at risk of suicide, right? Like, okay, we saw them just 2 months ago. Maybe we don't need to do the PHQ-9. Do you know what I mean? Like, it's easy to let like little assessment or screening things slide because we're like, oh, I just saw them last month. But what the research says is that really people within 30 days of completed what from a suicide have seen some sort of provider. Right. So if it makes sense for us to implement, there's anything from our policies and procedures. So we're changing a lot of policies and procedures, a lot of staff training. It's going to take us about 3 years to implement it, but that's what we're in the process of doing. And so I'm really proud of GHS for doing that.
I understand why, because it's really important. It's a really important resource. So thank you again.
Yeah.
Always good to see you.
Yeah, good to see you.
Okay, we're going to pivot a little bit. Thank you so much to GHS for bringing us those wonderful resources. As you can see, they've got great resources in the community and are always willing to share with you those resources. So thank you again. We're going to talk a little bit about sort of the elephant in the air, I guess we'll say, all of the particulate matter that's in the air. So we're going to bring Brad Snyder to talk to us a little bit about, from the health department standpoint, how do they measure air quality, what that looks like when they are letting the community know that we should be concerned or we should be changing our behaviors. So thank you so much, Brad. We really appreciate.
Yeah, thank you for having me. I appreciate it. Can you all see my screen up here right now?
Yes, we can see your slides.
Perfect. All right. So the goal for me today is to provide everyone with kind of a ground framework of what air quality is, how it's measured, how it impacts your health. Air quality can actually be pretty complex, and there's a lot that goes on into it. So hopefully this framework will help you be able to better understand it along with our other panelists that we'll be talking about today. So again, talking about air quality index, what that is, particle pollution, ozone, how to reduce your exposure to those pollutants, and also some additional resources for you to take home with you. So many of you probably heard over the past month or so this term AQI, or air quality index. So this is the EPA established the AQI for 5 major pollutants that is regulated by the Clean Air Act. And it goes on a scale from 0 to 500, as you can see in this color coded chart here. It's going to be able to allow residents to see what levels of air pollution are in their specific area. And the higher the AQI value, the greater the level of air pollution, and also the greater the health concern for individuals. The main air pollutants that we'll be reviewing today are particle pollution and ozone pollution. The other 3 that are utilized for AQI, but we won't be discussing in detail today, are carbon monoxide, sulfur dioxide, and nitrogen dioxide. So what is particle pollution? It's measured in PMs, so particulate matter. It's a mixture of solid particles and liquid droplets that are found in the air. So PM 2.5 is going to be your fine particles, measured 2.5 in diameter or smaller. These particles are going to come from things like power plants, industrial processes, vehicle exhaust, wood stoves in your home, and also, as we all know right now, wildfires. PM10 is going to be your coarse particles, so anything ranging from 2.5 to 10 micrometers. And those are going to come from items such as crushing and grinding operations, road dust, and some agricultural operations. So how does particle pollution impact your health? Particle pollution is going to cause several serious problems to everyone's health, including coughing, wheezing, reduced lung function, asthma attacks, heart attacks, strokes, and it's also been linked to early death in people with heart and lung disease. While it does impact everyone to various degrees, there are going to be particular populations that have a greater risk of having an impact. And those include individuals who have pre-existing heart and lung disease, such as asthma or COPD, older adults, children and teenagers, because their lungs are not fully developed yet, pregnant people, minority populations, and outdoor workers. We also don't want to forget our pets that we have in our homes too, right? So they are going to be impacted by particle pollution in many similar ways as us humans. The American Veterinary Medical Association, have a link here on the slide that you can go to, has a wealth of information about how wildfire smoke can impact your animals and pets at homes. So and basically the bottom line is if they're having any symptoms from the wildfire smokes, that you want to seek your veterinary care as well for those. So how can we, as a society, reduce particle pollution? So for us individuals, we can work on driving less. We can use energy more efficiently. So choosing Energy Star certified products at home. For cleaner heat, upgrade your heat to a heat pump at home, electric heat or ductless heat pumps. Keep your car, boat, or other engines that you own tuned. If you use wood for heat, burn that efficiently. And also avoid burning leaves, garbage, plastic, or rubber, because that will increase particle pollution in the air. So next we're going to talk about ozone. So unlike particle pollution, ozone is a colorless gas that can be good or bad depending on where it is. So ozone up high in the stratosphere forms the ozone layer, which is good because it shields the earth from harmful UV rays coming from the sun. Now, ozone at ground level is a bad thing, and that could be harmful to human health. So ground level ozone forms when volatile organic compounds, also known as VOCs, and nitrogen oxides react in the sunlight. So these pollutants come from sources such as vehicles, industries, power plants, solvents, and paints. And the ozone at the ground level actually forms in sunlight, and particularly on hot summer days, and is worse in the afternoon or early evening. So oftentimes you'll see when you're looking at ozone readings where you live, that they will be less in the morning and earlier hours during the day compared to the evening and afternoon hours. So how does ozone impact your health? Very similar to particle particulation, it's going to cause health problems, including coughing, breathing, difficulty breathing, and lung damage. Exposure to ozone can make the lungs more susceptible to infection over time. It can aggravate pre-existing lung diseases, increase the frequency of asthma attacks, and increase the risk of disease, death from lung disease. Ozone is harmful to everyone. No matter how healthy you are, it's going to be harmful to you. But again, some people are at greater risk from the effects from ozone. So people with lung disease or asthma, children and teenagers, older adults, and outdoor workers. How can we reduce ozone at an individual level? Again, we can drive less. We can turn off lights and devices that we're not using in our homes. Keep your engine vehicles tuned and don't let your engine idle if you can help it. Inflating your tires to recommended tire pressure to make your vehicle more efficient. When refueling, don't do the traditional top off where you try to get that little extra gas out of the pump, because that causes particulates and ozone to go into the air. Avoid spilling fuel when you tighten your gas cap. And then VOCs. So oftentimes, if you're going to be buying paint or cleaning products at the store, you can buy ones that are low VOC. So those are going to be helpful in reducing ozone in the environment. Apologies for that. In reducing your exposure to ozone. So staying, and actually this is going to be reducing your exposure overall. So ozone and particulate matter. These are some key things to think about. Staying indoors in an area with cool filtered air, if possible, closing windows and doors. For those who don't have access to those, look at shelters or cooling centers in your area that you can go to for cool filtered air. Try to keep your activity levels low when there are air advisory levels that are because of hazardous conditions. Using HEPA air filters in your HVAC system at home. Avoid using anything that burns, such as wood fireplaces, gas logs, candles, or even incense in your home. If you need to vacuum when there is an air advisory, make sure that you're using a vacuum with a HEPA filter. Otherwise, you're going to be stirring up more particulate matter in your home. Also, especially right now with the wildfire smoke that we're seeing that you can actually see outside, if it is at a high level, wearing a well-fitted N95 or P100 mask is of benefit to you if you must go outside when it is smoky. Also, when you are driving your vehicle or riding in a vehicle, be sure to have those windows up. And if you need AC on, there is a recirculate button in most vehicles that have AC. And you see here on the bottom right, circled in red here, is what that button looks like on most vehicles. And what that's going to do is prevent new air from outside coming in. It's just going to recirculate and cool the air that's already in your vehicle. In regarding the masks, the Genesee County Health Department, I'll have my contact information here below at the end of the presentation. We do have N95, KN95 masks available in limited supply. We primarily like to get those out to vulnerable populations who may not have access to indoor areas that are with cool filtered air. So feel free to reach out to us at the health department if you'd like more information about obtaining those. Onto some resources now. So airnow.gov is highly recommended site with both national and local partners at government levels putting together air quality data for everyone. So airnow.gov, these are a few screenshots of what you see. And these are actually screenshots taken from yesterday evening for the Flint area, where you can see that the air quality was on an AQI scale at 172, which is considered unhealthy for everyone. And also that it provides a map similar to what you would see for a meteorologist forecast for rain and storms coming through. It will show you where those different colors from the AQI chart are on the map. And as you can see, yesterday evening was really, really bad for all of the Lower Peninsula of Michigan. In addition to that website, enviroflash.info is another EPA affiliated site that you can actually sign up for air quality alerts. And you can get those via text message or email. And you can see here the website you can go to. You just put in your information and you can actually customize it too. So you can get alerts based on where at on the AQI scale that you would like the alerts. So maybe you're in a sensitive population where you would like alerts at the moderate level, you can adjust your settings to that. And for everyone, but most especially for those who may not have access to the internet, Michigan Department of Health and Human Services has set up a hotline for Michigan residents to ask health-related questions related to air quality issues. And the number is here right on this page, 800-648-6942. The hotline is available Monday through Friday from 8 a.m. to 5 p.m., closed on holidays. So it will be closed this Tuesday for the 4th of July holiday. And then I'll end here with my contact information. Again, if you have any further questions or if there's anything that pops up afterwards, feel free to contact me at the email address here.
Thank you so much, Brad. This is awesome. Can you go back to your slide that talks about what people should and shouldn't be doing? You had like the N95 there and a few other things. Let's see. Okay, there's one right before this too, I think. Oh,
So this is reducing ozone, and
Right.
so this is reducing how to
Yes.
reduce your exposure in general.
I just
And
feel like
also,
reminding people of this is so important. Go ahead. I'm sorry.
yeah, on the right hand side here, there's a little screenshot that says primary pollutant, and it has the 170 number. So this is taken from the airnow.gov website. So in addition to the graphic of the color of your area, this will pop up too to let you know what are the recommendations for the general population and also special populations during an air quality advisory.
That's awesome. These are really great resources. Thank you so much. All right, I want to bring our panel forward, and I've been like figuring out how to bring you forward, and I kept thinking like we've got a public health expert, an epidemiologist, a peds doc, a family doc, a pulmonary doc who will all walk into a webinar. Like we've got all the expertise in the room, which is so awesome. Thank you all for being willing to share your expertise. And like Brad, you've answered some questions about how we measure air quality, a little bit of why we're seeing some of this smoky, hazy skies. I want to talk to Steve a little bit about sort of what our expectations around symptoms should be, right? So Brad suggested that there's some air quality levels at which we might experience symptoms. Can you talk to us a little bit about what those symptoms might be and what we would expect?
Yeah, I thought Brad did a great job, really kind of bringing home and summarizing really the effects of how to measure it, and he touched upon a lot of this too. When common symptoms include kind of cough, irritation in your lungs, often seen in people who have a history of maybe asthma or chronic lung disease like COPD. But even in people who don't have those underlying conditions, you might have just kind of more difficulty breathing. A lot of times people have allergy symptoms. But the other key is that sometimes pollution can be kind of, the symptoms can be insidious. You might not have daily symptoms, but the epidemiologic data really show that, exposure to air pollution long-term increases your risk of other chronic lung diseases, other systemic diseases like heart disease, high blood pressure. So there's both kind of the short-term effects, but there's a lot of long-term effects too.
Absolutely. And I want to remind people, you're a pulmonary critical care doc. So this is sort of your bread and butter. This is sort of what you see every day. Are there any things that you specifically want to talk about as we think about what we're seeing in the air and what precautions we might need to take?
Yeah, I mean, I think some of the things that Brad mentioned are good advice to try to strategies to mitigate. You could try using wearing N95 masks for your own personal protection, trying to limit some of that outdoor activity, using, if you have ability to kind of run your air conditioning and having HEPA filters indoors. For some people who have chronic lung disease, maybe using your, making sure you stay on top of your inhalers if you're prescribed those. Sometimes people, will tell people to take, extra doses if they're having symptoms. But then some of those other chronic conditions or having exposure to air pollution, as I mentioned, can increase your risk of like even lung infections. We saw that even in the epidemiologic studies for COVID, we saw that people who lived in more higher polluted areas had a higher risk for severity of COVID illness. So some of those things are difficult to mitigate, but like you would want to try to, avoid if possible, exposures to that pollution.
That's super helpful. If we could bring Bob forward too, as we think about this, because we've got your wonderful expertise as a pulmonary doc, and Bob has done a lot of work examining sort of asthma disparities and thinking about this from a public health standpoint. So Bob, and we can keep Steve up, we've got tons of expertise to share. Bob, what have your thoughts been? And I know part of the reason we reached out to you is because you had some really thoughtful comments about how people who have experienced disparities before are probably going to be most at risk for disparities down the road from this air pollution. So could you talk a little bit about that?
Yeah, sure. Yeah, so the air pollutants mostly have an additive effect. So vulnerable populations, which includes children, elderly of 65 and older, and those with chronic illness, like folks that have asthma or chronic obstructive pulmonary disease, COPD, or have heart disease. They are, and also people that live in areas of higher air pollution. They sort of are more susceptible to increases in the wildfire smoke, because you're adding wildfire smoke on top of the air pollution they're already exposed to. And so you basically are going to see, so anyhow, if you have asthma or you have a heart condition, you're more susceptible to an asthma attack or a heart attack. So is that what you wanted me to talk about?
Yeah, absolutely. But I'm also going to defer to your expertise, because anything that you want to add and share with the community is fair game here.
One thing first off, Brad did an awesome job, and
100%.
so I don't have a lot more to talk about. But one thing I wanted to sort of talk a little bit about was what wildfire smoke is, because basically it's everything that burns, right? So it's the trees and the plants, but it's also the treated wood, it's the furniture, it's the carpeting, it's everything that's in the way. And so a wildfire smoke it's PM 2.5, like Brad said, but it's also all these other chemicals that are sort of going up into the air when things burn down. What else?
And let's bring Brad up, because one of the things Brad said that like broke my heart a little bit is like, don't burn your candles. And I'm like, wait, I can't have my candles.
Yeah, well, I would avoid them during times of hazardous conditions, otherwise I think you're good to use your candles. But
All right, so I got like get past Friday and then I can use my candles again.
Yeah, and also it's all a personal choice too, and if how the current smoke is impacting you from a personal level.
Sure. I really appreciate that insight.
And I think I agree, like Brad really summarized it greatly. One of the challenges now is that there are different types of pollutants. He talked about ozone often being, worse in the summer. In different parts of the world, sometimes PM might be worse in the winter. But right now we're in this conglomeration where, with the wildfires and the summer, you can have both of them. And that actually, I think, drives a lot of why that AQI is a good index of kind of everything. Instead of just looking at these individual components, it kind of summarizes everything. It kind of combines it all. And you have that combination of both kind of the ozone level and particulates. And that's what makes it particularly, pardon the pun, particularly difficult.
Unintended. I love that. We haven't talked anything about like why the wildfires are happening, right? And Brad talked a little bit about it, you touched about it, but I wonder if you all have any thoughts about that and what we can do to sort of prevent that risk.
Well, definitely with climate change, we're gonna have more wildfires, and so that has to do with drought, and it has to do with you have to take care of your forest, and so you have to sort of understand that the forest goes through these. And I'm not a forester, but I'm not a forest expert, but they go through the cycle, and so forests need to burn down every once in a while. But we don't want all the forests burned down at the same time, because it overwhelms our ability to put out fires and to overwhelms our ability to stop them from burning down homes and things like that. So this is like, as things dry out, we're going to have more and more of these. We're seeing in the Western US also.
I feel like we're seeing less, at least I've seen less about it. I remember when I was growing up, we had the little Smokey the Bear commercials, right? Am I aging myself here, right? Only you can prevent forest fires. I haven't seen those as much. I want to bring Brittany up because I can see her nodding, and I want to ask her a little bit about how this is affecting kids. And I'll give you some context. Both me and people I work with had kids' events canceled that were outside because we were trying to protect kids. And I wonder if you talk a little bit about our expectations there.
So, I feel like the three individuals, Brad, Stephen, and Bob, though I have to call you Dr. Wall, but he was my epi teacher last semester. So I could say that he's a great epidemiologist. But anyway, have really covered a lot of the things that I would say that as a pediatrician, I feel are true. The big thing I always want to point out too is that I know that it was mentioned, that children and adolescents are at higher risk just inherently being children and adolescents because they literally use more air over their body surface area compared to adults, and their lungs are still developing and things like that. So if you have a child who has asthma or any sort of chronic lung disease, it's a further compounding of that. And so any sort of damage that happens to an adult like myself will be even worse in children. So so being outside and doing those activities is going to be, again, worse for a child. We've been calling a lot of our patients to talk with asthma to talk about kind of what our plans are in terms of their asthma control, and if there is things that they're going to do outside or they can't limit it, or particularly in some of our disadvantaged communities, that maybe we will treat this almost like preventatively and start to be a little bit more aggressive in our treatment, just to make sure that we don't get into an asthma exacerbation. I know we just got out of a horrendous allergy season. Now our cars are finally not going to be covered with pollen, but now now we can't see anything. So we're kind of treating it in a similar manner to that. I think being on the safe side, particularly with a lot of children's events, and staying inside during that time is really important. So as unfortunate it is, particularly coming into this holiday weekend, it's for the best. So
That's super helpful. I appreciated that you talked a little bit about a preventative approach that you're doing with children who might have asthma. I wonder if the experts on the screen can talk a little bit about any preventative measures that people who are older and immunocompromised in some way, or who might have asthma or COPD, might think about. And we talked a little bit, Brad, you shared some wonderful strategies. I wonder if Dr. Wong or Dr. Wall or anyone has any thoughts on, okay, what do our older people who might be immunocompromised, what should they be doing as preventative work?
And Brad may have said this, but there's portable air filtration devices, and if you get one that can take out fine particulates, then that significantly reduces your exposures. I know that, like, the Michigan Department of Health and Human Services, those are good folks to follow, by the way, as far as producing health related sort of helpful information. They suggest when you get into these high levels into like hazardous areas, that they close up all your windows. And so, of course, if you don't have air conditioning, you can't do that. If it's too hot outside, you can't close your windows. And so what they suggest is that you then find someplace else to go. So like for I was in the climate change trials at GHS, was in the program for a while, and we actually we would set up cooling zones like malls and things like that. So the different area, and this might be a question for Brad. So different areas, different local health departments might be providing cooling zones for people that it's just too hot in their home, especially when they have to keep all their windows shut.
Go ahead and let Brad talk about any potential resources or spaces for people who might be experiencing that.
Yeah, there are community partners. Unfortunately, I don't have a list of those in front of me right now that do have sites within like Flint and Genesee County for cooling centers. But maybe we can compile that list and get that to you all to send out at some point.
Absolutely. And if there's a website that people should look at, feel free to put that in the chat if that's going to be updated with where people should go.
Yeah. Heather
Dr. Wong
mentioned Carriagetown Ministries, and I believe that is one of the sites.
Carriagetown is a wonderful partner. That would be great resource.
I think Rob and Brad, said it well. And one of the challenges is that we need to breathe, right? And so we can't stop breathing, and so really it's just a matter of trying to decrease our exposure. And so that's either kind of closing windows, cleaning, filtering the air, having an HVAC if possible. But these are all challenges. I think what Brittany mentioned was really great about protecting our kids too, because even though I'm an adult pulmonologist, our lungs keep growing from the time we're born all the way until we're kind of in our mid-20s or 30s, because our bodies grow. So we often hit our peak lung function at that age. And if we to our kids, if we're not good to our lung function early on, we may never hit that peak lung function, and that affects adults. So many people in the healthcare field believe that a lot of adult diseases sometimes begin in the youth and when we don't hit that peak function.
Is that something that you see in your research, Dr. Wall? Like this idea, it's kind of what you alluded to about cumulative exposure, right? So if our lungs are always growing and, Dr. Wong is talking about at older age, you think that some of these diseases might be the result of things that happened when people were younger. That sort of seems to dovetail with some of the things that you said about cumulative exposure.
Yeah, and there are a lot of epidemiologic data showing that exposure early on can lead to a lot of late childhood and now also even adult diseases, especially in the world of air pollution. Data is shown also in cigarette smoking. So cigarette smoking is almost just kind of like an extreme form of air pollution, just locally in some ways. So yeah, certainly I think early exposures can lead to kind of long-term health effects.
That's super helpful. Can you talk, this is probably for Dr. Wall, why are areas like Flint or cities sort of big hubs for this? Obviously, there's some element of industrialism and the jobs and the workforce around the area, but there's also this concept of green space, right? And I wonder if you'd share a little bit about why that's important and how that can contribute to overall air pollution.
Yeah, I mean, there's been a lot of work looking at green space and mental health, but green space is also important for physical health too, because as you just said, Jennifer, you have when you have industry and things like that, they can produce a lot of pollutants, and actually trees and green stuff can sort of help collect that and they can take in the CO2 and they can sort of help. I think remediation is probably too strong a word, but they can help sort of minimize the effects of those air pollutants.
Important. Thank you so much. I wonder, so people right now, you can go outside, right? And you look up and it's pretty clear that the air does not look good. But when it clears up, does that mean it's okay to be outside? Is that sort of the metric for people? How do people know that it's okay, that they can go outside and they're fine?
Air quality index. Air now, you can get EnviroFlash, just like Brad said, you can sign up and get and with EnviroFlash, you get like the next day, sometimes 2 or 3 days in the future, where it predicts what the air quality is going to be like. And so yeah, I mean, back in the day, you like downriver, especially in Michigan, you could see the air. Well, we don't really have that anymore, and so you can't count on not seeing it. You have to sort of count on, our air monitors and our modeling and things like that.
So just because there's blue skies doesn't mean that everything's in all go.
I mean, it's better, it's better than having all that stuff flying around the air and reducing our vision and stuff. But yeah, you can't count on that directly.
Okay,
Yeah,
so what is go ahead.
As Bray was saying, that these particulates, especially the PM 2.5, I mean, they're 2.5 microns, which is like really a tenth of the diameter of a hair, right? So yeah, a lot of times you're not able to see it, the size of like a little bacteria molecule, and you're not able to see these. So that's the challenge. Yeah.
All right. So I'm telling my kid when she's like, but it's sunny and it's blue skies, I'm blaming you all. Like I'm totally, I'm totally.
But you do want to balance. Hey, we do like the outdoors, right? And it's that's also important to our health too. Getting activity, as we learned that from COVID too. Just kind of the connection, doing things and being active is. So it's a balance, you want to do things in clean air, but, to also be the ability to do outdoor activities.
I have one last question. It's if people are feeling like they do need to get outside, but the air quality is really bad, is there a time of day that it can be better for people to think about getting their work done?
That's one thing. So we need to remember that ozone's still out there, and so just because relatively speaking, the PM 2.5 sort of taken over for a while, ozone still has some high days. And so ozone is always is always higher in the afternoon, mid-afternoon to late afternoon. And so
You'll get your work done in the
if you
morning.
go out in the morning, you still have your PM, you still have your particulate matter because of the wildfires, but you're not going to have the ozone issue. So at least you're reducing your exposures.
Thank you so much. You brought such wonderful expertise to the community. Thank you, Dr. Wall. Thank you, Dr. Wong. Thank you, Brad. Thank you, Dr. Taylor. We really appreciate all of the wonderful support and advice that you've brought today. Thank you to GHS also for their wonderful resources and helping us produce a great webinar. Happy 4th of July weekend. There's not going to be a webinar next Friday, so we'll see you July 14th, and you can visit our YouTube channel for past webinars. Thanks so much, everyone.